Kaboom! You never tell me you're
Wow,
live,
man, so
dog.
delayed. I did the whole
You didn't.
thing. If I say you're live and then you go, it's then I
All
start.
right.
Man, you're
Kaboom.
supposed to start off. There you go. All right, cool. All right, we'll edit that out. Nobody leaving now. What's going on, everybody? Back again for another episode of the AIB Show. This is Amit,
And Dominic.
and we're back. For those watching on these socials, you'll realize that I'm still in the same T-shirt and Dominic's wearing a different hat, appearing as if this is a different day where it's not.
I didn't realize you noticed that.
That's what you laugh. This
That
guy
is
has
why I
a
laughed.
wardrobe change
That
for no
is why I
reason at all.
laughed.
So for those of you who want to enjoy the comedic pleasures of what this is, feel free to check us out on the YouTube or the Facebook or wherever we're at, because we're actually live. All right, talk to me, Dominic. What you got?
Health and fitness.
Oh God.
So, a Colorado hospital has now mandated that they will no longer do transplants, or most transplants, for people who are not vaccinated, under the guise of protecting the patients themselves. But here's an interesting one. There was, or is a lady, according to CBS Denver, that was about to receive a kidney transplant, but the hospital won't do it because she is not vaccinated, nor is the donor vaccinated. But the whole premise is it's not to protect the staff, it's to protect the patients. But if both patients aren't vaccinated and this woman needs a kidney, why the frig would they not do the transplant? It's illogical. There has to be mechanisms for using common sense within these regulations if we're going to mandate such things.
Yeah, I saw that article too, and then I saw another thing that went along that same line that was talking about the fact that, again, not saying that one is correct or otherwise, but saying that there are many vaccines that are mandated prior to other procedures. So in general, the vaccine procedure protocol has been in place for other vaccines. With that being said, to your point in this scenario, yeah, I have an answer for you. It just seems very, to your point, it's very letter of the law versus, using nuance where nuance is applicable, i.e. here.
Yeah. Also,
mm-hmm.
hold on. Talk for a minute. My dog going crazy.
Oddly enough, can't hear your dog. I get, you put him on mute anyway, so I'm assuming the dog is going crazy.
Chat,
can't hear him at all.
Chat. I gotta let him outside.
Yeah, I am. Oh God. Dominic's going outside, so I'm by myself. So if somebody's on the Facebook or whatever, hit me up. Let's chat. What's going on? I'm actually sitting here just trying to wonder what Dominic wants to talk about today. He said he wants to talk about health and fitness. And for those of you who know, Dominic is of questionable health and fitness. Oh, he's back. You heard that part.
What was that?
I said that you want to talk, as you mentioned earlier, you want to talk about health and fitness. And I said, as the audience probably knows by this point, you are of questionable health and fitness.
First of all, jackass.
Okay. How am I a jackass?
I'm not in questionable fitness. My fitness is not in question. It's not good right now.
It's not existent. I'm sorry.
It's not. But I explained to you what's going on.
Yeah.
Right before we went on.
True.
So yeah, my orthopedic surgeon told me I need to change my lifestyle and be like our friend Dre and just use a elliptical machine for the rest of my life, because even if he does surgery on my knee, he can't fix the pain. To which I replied, Doc, that can't happen. I still need to play football against kids half my age. And I still strive to be a very, very subpar CrossFit individual. And right now, I'm not even remotely close to that. But the goal is to not even be mediocre; it's to be subpar. That's what I'm aiming for. As Amit knows, we once did a competition in Aruba, me and Amit, and I'd say for the first 10 minutes we were neck and neck talking shit, like just going and going, and I was like, all right, I got a shot. We're keeping up with this dude. We're doing, and boy, we hit that probably 15, 16-minute mark. I started slowing up. By the time we got to the road, I was done. I mean, done.
It was very comedic.
Why did I even think I could even compete with this guy? No.
It was very comedic to me.
But again, that's when I would say I was mediocre then. That was the height of my CrossFit. I was mediocre. Yes. Need to get back.
Yeah, no, I just find it, I would love to see you just rocking the elliptical thing away, like at this point, just get a 24-hour fitness membership and just chill out, put your headphones on, and just zone out. You can do the actual step machine. Christelle has one of those. She just bought the actual Stairmaster, one that's the actual steps that go through like escalator status. She just got one of those for a garage. It's probably the biggest machine ever made. But yeah, I mean, that one does hurt. Yeah, maybe we can do that one. You know, you just got to do just stuff that's not actually athletic. Because that's what I'm saying for you.
Differently still, even that, if everyone in the country did just that, we'd be a lot healthier. Even as much as we joke about elliptical, and it at any age, just not our sedentary.
Yeah.
Sedentary
and
lifestyle.
then we'd all live till later in life, which would be awesome. And then we'd have no social security to pay for anybody. So then we'd be extreme poverty.
No, it's
and
not.
Then we'd run into a situation where
fool, it's not just about living to later in life.
Ourselves.
It's not just about living later in life, because naturally as humans we are living later. It's also about enjoying your quality of life, being able to pick up your grandkids, being able to walk properly when they're younger, being able to not die of heart disease, #1 killer in America.
No.
Being able,
not being
a burden on society, you know, financially, not leading to these tragic healthcare costs, right? All that.
Agreed. Except that we will still need to change the way that we employ people, change the retirement scenario. We will need to change the way all that stuff have to change to support people lasting longer and longer. And that's a weird way to put it, but people living longer and longer. Sorry. Because the current economic structure isn't built for people to live, the majority to live for a very long period of time, just the way it is, right? And so that'll have to change as well. And if you could speak into the mic and unmute yourself, it'd be awesome.
Hey, you're looking at in front here. I'd kick you in the bread basket.
As a bread basket, yeah. Okay, fighting against
health,
Joe Biden and using Joe Biden phrases. I like it.
Speaking of health, Sanjay Gupta. What is his title now again?
CNN health dude.
No,
period.
No, dude. Wasn't he?
Sanjay Gupta is now?
Maybe he's now, but he was.
He's an American neurosurgeon, and he is chief medical correspondent. Yeah, I told you, health dude.
Oh, I thought he was. I thought he had some. Okay, anyway, most people know Sanjay Gupta. He came out this week talking about gut health, and about how pandemic proofing your life is not what you think, and talking about, guess what, diet. Pandemic proofing your life is easier than you think, and it's not about building a bunker or mega dosing on supplements or waiting for the next booster shot. A remarkable suit of armor is already within you. It's fascinating that finally someone's come. Fauci should have come out with this long time, and not just as address to COVID, right? Just as address to overall health, which I've been talking about. He wrote, studies in the past year alone have highlighted the significance of the microbiome in people's prognosis with COVID. Associations found between gut microbiota composition and levels of inflammatory markers in patients with COVID suggest that the gut microbiome is involved in determining the magnitude of the COVID infection. In other words, a significant predictor of just how ill you are likely to become is the status of your gut microbiome at the time you are infected. Kaboom.
So I'll have you know, I've actually done one of these microbiome tests or these gut tests before, because I've been like 3 years ago, actually, I think. Got the results back. And I didn't understand a damn thing that it said, bro. I had no idea what was going on. I was like, I wasted how much ever money it cost me to get this test. And I did not know how to adjust my life. And I was like, F this thing. A friend of mine in New York schooled me to it. Go ahead.
But it's because you probably didn't go to the right individual to discuss it.
No,
right?
It was so I had friends who, the reason I even knew about that is I had friends in New York who were all about this gut health life, right? So the problem with gut health situation is that you have a lot of, so Gopal, prime example.
He changed his life yesterday.
What did he do yesterday? He changed his life?
Yeah, or 2 days ago. He claims he had a long talk with my better half, and he's sending us what he's eating and doing things. But we'll see what happens. Anyway, go on.
He bought goggles when he was here last time. So I swim laps. Yes.
I swam.
I guess that would make sense.
Speaking of fitness, I swam last night because it's the only thing that doesn't hurt me. I'm back into doing that. Yeah.
No, sometimes like you jump in and you've reached one half.
Sometimes in the nude.
Wow.
True fact.
If ever your kids listen to this,
Shrinkage.
your kids will.
Go on. Go on.
Wow, man! If your kids ever listen to this, they'll never get in that water ever again. Just the idea. Oh my God! Don't go to pool party at Dominic's house. So what he's trying to tell you.
Go on.
But also, so when Gopal was here for one of his extended stays, I try to swim laps in the afternoon whenever my schedule allows, right? So if there's a break, if there's a half hour to an hour break, actually I need an hour. I'll go swim laps and come back. So he's like, yo, I'll come with you.
Question: do you do like intervals or sprinting or just consistent flow for
consistent flow? I'm trying to just keep the heart rate, trying to see if I can keep going.
Okay.
So it's a new thing for me as well, right? Because it's been a year since I did this. Last time I actually did it consistently was actually back when we were at Miami, which is 20 years ago. And then because in California,
before that, when we were kids, our schools used to compete.
And I would literally always win.
5 to 8 years old, 9 years old.
I was the G. I used to win all the time. With that being said, my technique was garbage, but that just proves that we weren't really taught much by way of technique. But I would literally just keep my head underwater and finish lengths, and that's all that mattered. And I would win.
They somehow had me swimming backstroke in Jamaica as a obese little boy, not little, big boy. It made no sense because
probably just more buoyant. It just makes sense. You're like a Freightliner just cruising along.
it was like a tidal wave in that pool. I was in there. All right, anyway, my bad. Go on with Gopes and the guys.
No, I was just saying. So Gopu friggin' so he comes up here. So okay, so two things. One is we bought goggles and swim like he's like, yo, I want to swim laps with you. And I was like, why? And he's like, bro, I swim all the time in Jamaica. We're good. I want to swim laps. And I was like, again, why? I was like, you're going to do this consistently or you're just trying to do it for one day? If you're trying to do it one day, there's no point. Just relax. Have a Coke and a smile. Chill out. Then he goes in, buys goggles. He comes in the pool. We swim. I want to say man does like, I don't know, maybe a couple laps or whatever, if that. But also head above water. So the goggles, I don't understand the concept, but neither here nor there. Then and then he was sitting there just, he was just chilling off to the side. So now he sends me pictures. He sent another one today saying another day, another goggle is what he writes. And he shows a picture of the goggles at the beach.
Hold on. What sense does that make?
I don't know, man. He sent one yesterday.
Hashtag another day, another goggle?
Not the hashtag. He just wrote this phrase in WhatsApp for some reason.
Another day, another goggle.
Yeah, that's what he writes. I was amazed he actually spelled it right versus writing Google. That's what I thought he was gonna write, but he didn't. Anyway, so that's one thing. And then he would call me and go, yo, dog, what do we do? He goes, yo, I'm all about the probiotics life, man. I need to get on the probiotics. And I was like, do you know what that means? Do you know what that means? And he's like, no, but here it's good for you. Do you know there's so many, it's not a one-size-fits-all situation. You have to truly understand where you're at versus what works for you and so on and so forth. Much like, and I use the word dieting, but I don't literally mean stopping to eat, but I mean what you consume, right? Like things you can handle,
I was actually about to use food as a reference point. Yes. Yeah.
But you can't just go, I'm about the probiotic life and jump on that. Like that doesn't make any goddamn sense. And so people hear buzzwords, jump at the buzzwords. I'm like, stop doing that. And that's where the Gopal thing came. So that's full circle. But you're saying that he's not reaching out to your.
I've no scientific evidence of this whatsoever, but it's like my belief is everybody's body is different in terms of what they ideally should eat, right? Of course, there's allergies. That's the obvious thing. I'll die if I eat shellfish. Yeah. But I went.
You sure that still exists? You don't want to try a shrimp every now and then?
2 years ago. 2 years ago, it happened, dude, at dinner. Where I was eating a lobster mac and cheese and I was scrambling around the Hard Rock trying to find, I had to guzzle a bottle of Benadryl.
Hold up, you ordered lobster mac and cheese knowing you have an allergy?
It was a big group and it was there and I saw mac and cheese and I started chewing and I thought I didn't swallow. I was chewing. This mac and cheese chewy. I chew it and I spoil. I tell you,
some bad cheese.
I was like, yo, some weird cheese. I'm like, hold up. Yo, what's in that mac and cheese? Like, yo, it's lobster. I was like, yo, that's not good. Anyway, I went pescatarian over a year ago. And my life feels so much better since I did that. But I don't think that that means that everybody should do that. You know, if getting the nutrients and eating good meat and things like that does well for your body, I'm all for it. But you know, you have people either way. You'll have people that say going plant-based or going vegan or is absurd. You need this, or the opposite. Like, I'm vegan, I'm vegetarian. How the hell could you not even consider it? You know, you're ruining your body by eating all these other things. Everybody's so extreme. I just believe in what you experiment with it and does well for your own body. Simple as
No,
that.
but I mean, it seems pretty logical because there's some people who need coffee in the morning, right, and literally thrive on that. Some people don't. Some people again,
I've never
with
had
food,
I've
everybody's
never
got
had
different
more
food.
than a sip of
See,
coffee in my life one time.
and I'm having it's a cup number 2 right now, right, or 3, whatever it is. But my point is that people, well, there's things we all have allergies and everything like that too. So it's not like everybody should eat the same thing because that doesn't make any damn sense, obviously, right? Some people can't handle spice, some people can't handle certain things, right? Turns out I found out that I'm recently allergic to. Recently, I just found out beans, and I used to love me some black beans. So that's a dangerous situation.
Yeah, but I figured you would have kicked them long time with the inflammatory of the legumes, the inflammatory responses.
Yeah, but it tastes good and they're filling. And what's wrong with my clock?
I don't know what you're talking about. Keep going, keep moving on.
This guy.
Okay.
So okay,
wait, so we finish this real quick. So Sanjay says this to finish. If I could find it. It should come as no surprise that a typical Western diet, high in salt, sugar, calories, and saturated fats, is not friendly to our physiology. As research concludes, a plant-based diet is rich in a variety of fresh whole fruits and vegetables, particularly berries and green leafy vegetables, is associated with better health. You'll like this. I know you have heard this countless times and you may be numb to it. I am too. Maybe numb to it. So that's the thing. People hear this and you always say it doesn't affect them because if they make a change, they don't drastically see it right away or feel it necessarily or can test right away. It's a long-term change, which doesn't bode well for getting people to do things. The last thing he said is this, but there are a few simple statistics I often share with my patients to make the point. For instance, if you increase your fruit intake by just 1 serving a day, this can reduce your risk of dying from a cardiovascular event by 8%. Dog, that's huge. 8% is no joke with your life. The equivalent of 60,000 fewer deaths annually in the United States and 1.6 million fewer deaths globally. There are few medications that offer that much impact so easily. Think about that again. Few medications. And now you can be sure that a regular handful of berries or a juicy apple can also reduce your risk of experiencing a severe illness from an infection like COVID and its future siblings. Kaboom.
He still sees patients?
I guess so.
Figured he was just a CNN man. I didn't think he was going into the office at all. That's number one. Number 2 is, go ahead.
So the message should always be vaccine COVID, not just vaccine. I mean, not vaccine COVID. Vaccine health, vaccine health, vaccine health.
Are you trying to tell me that the people trying to push us out aren't good at marketing? Because it's almost like I've been saying that forever about everything related to this and about the Democrats in general. They're just garbage at marketing and they're in power right now, which is why I'm calling them out. But yeah, it's marketing. It's all marketing, guy, plain and simple. But here's one thing that I will say. What does bother me sometimes, people go, we should eat more X. It's been eaten or it's been consumed by people in India since God knows when, and they live till 100 and whatever, right? Imagine if we just consume more X. And I hate that entire statement and thought process. Hate's a strong word. I dislike that entire statement and thought process because that assumes that is the sole reason for their survival or their longevity. And the other part of that too is 9 out of 10 times, those people that people associate with, right, are living in remote ass places where they don't have the exposure to the stuff that we have, the stresses we have.
The stress, the processed foods,
forget,
the sugars.
No, you're talking, forget the processed foods. Just the general relation, the stress, the mobile phones, the this, the that, all the different stimuli that affects us in life, independent of stuff we're consuming, generally around us, that literally affects our daily lives, they're not exposed to, right? So they live longer because they're not impacted by all these things again, their diet does help too. I'm not discounting that, but I'm saying
It's a huge fact. But
there's
that,
all
but,
of the things that attribute.
yeah.
All of the
But I
things
think
affect
I
that
think it's
process.
more relevant to look at the diet when they're saying use the diet they have.
No,
Right?
because
So
then
I
on
think
the flip side,
so I think the lack of the improper diet is also as important. When you're saying, hey, these people look what they eat this thing and they live long.
but then on the flip side, there was one that they showed. I forgot where it was. There was I saw some. It's a small town in Italy. Average age is old as shit, and average alcohol consumption high as hell. Wine all the time, so on and so forth. Food and beverage, pasta, all the things that were high carbohydrates, all things that would be frowned upon in the standard U.S. diet, and longevity. There's a lot of other attributes, right? There's always outliers in every society and culture that does that.
I've seen a town like that because they're walking all day just to go get to the store. And a 90-year-old guy is walking up steps, walking like it's nothing. They've been doing this.
Have you not been in New York?
It's a calm. No. But I was going to say it's a calm and stress-free environment. New York is the exact opposite.
In this town, this is what I'm saying.
In this town, they're casually going in there, going to the bar, having some wine at 90 years old, walking back. It's not TV. You get together as a family thing. You talk and you laugh, and you don't have all these.
But this is my point. My point is you can't call one specific thing out. Like you can't say this is eat more of these, eat more blah blah blah. Now again, that does assist, but there's
right. But you can in the fact that these certain things can be anti-inflammatory or anti.
But you're also assuming that the person consuming that is consuming that because of those functions, where those people consuming it probably just consumed because it was there in their backyard.
Out of
necessity, and eat a shit ton of carrots.
Necessity or all they have. Yeah.
That's my point, right? So it's like, oh, they found the secret in acai, and it's like, no, fucker, acai was next door to them, so they ate it.
You know what Gopal called acai yesterday? He sent us a picture and called me and Katie and said, "Yeah, I mean some acai." Acai.
None of that surprises me, man. None of that surprises me. But that's my issue with that whole situation, where you're calling out one particular thing and said they found the secret. Nah, man,
right, so
it was the thing that was closest to them.
Let me ask you this then, because it might have been Zeke or somebody suggested we need to come up with solutions long ago. Was it Zeke who
plausible.
Said, that we talk a lot of things. The solution with what I'm railing about diet and fits, you say poor marketing. What is the solution to get? Let's talk specifically. Minority communities in urban areas that have even more, but it's not because water costs the same as a Sprite. So it's not dollars and cents.
Water does not. First of all, that is a lie. Water does not cost the same as Sprite. Period. Go to any restaurant, unless it's water out of the whatchamacallit, out of the fountain thing. Go to any fast food restaurant. Go to any restaurant that serves beverages or otherwise, and order a bottled water and order a soda and see what's cheaper. Soda is cheaper, plain and simple.
Walk into a gas station or a bodega. Many times you can find a bottle of water cheaper than a soda.
Size difference. The bottle of water you're getting is not the same size as a soda you're getting. One's 20 ounces, and that's not 20 ounces. You're not getting the same volume.
What's the soda?
You're not getting the same volume, 20. You're not getting the same volume for the price, period. Water is not cheaper than, that's the problem. That's one of the issues.
Okay, here's the thing.
You're right.
No, time out. Here's the thing. In terms of, what's the thing I'm looking for? I can't think of the word. Okay, you go to Whole Foods, right? It's not elite. It's damn it, I'm drawing a blank. The privilege to be able to afford to drive to go to Whole Foods. It's not in most communities across the country, right? You go there. Water is the cheapest thing you can buy there. You buy the water. You buy a jug this big, thick, like this, 79 cents.
Yeah. If only this wasn't a visual medium, but yeah, okay.
Right? So that's a privileged small thing where water is 100% cheaper.
Correct.
I went to the gas station today because I still have water in my house to buy a 24-pack of water, and this woman charged me. This woman charged me. Hold on. You talk. Hold on. Damn dogs. This woman tried to charge me $11 for a 24-pack of water. Mm-hmm. And I said, "Excuse me, madam." It rang up as Aquafina. This is Zephyr Hills, first of all. And it's saying $11. She goes, "Yes." I said, "I've never paid $11 for a 24-pack of water in my life." She goes, "I always bring it in." I said, "There's no way." And hey, to your point, that's dollars and cents right there. Because who the frig is paying $11 for a 24-pack of water?
Have you not bought smart water?
My son was like, "We're doing that." I was like, "No, we're going to Publix and I got the same thing for $3. So what I do, I got two 24 packs for $3. But that being said, there are.
So you want more plastic in the environment, but you're okay with that part.
No, I have to, because mind you, there are theories out there that it's better to have plastic than the means of recycling and long-term in the earth to just bury the plastic.
We've had this conversation.
Right? We've had that conversation. But there are absolutely, it's not just dollars and cents. So you need to stop that. It's not, because it's food. No, it's not. It's food deserts. There's demands for product. It's absolutely, there are food deserts, right? And it's ignorance. It's not just dollars and cents. It isn't, because you can go and prepare meals cheaply, right? Now there's convenience of grabbing it on the go, but you can absolutely, if you have access to produce and have access to other foods, you can produce meals cheaply. Now you're assuming that people are eating, which some people are, say a McDonald's 3 meals a day, which even the working class and lower class are not, right? They're often doing it, for lunch because it's quick to go. They're often doing it, grabbing it for dinner, but it's not as if all of these people in these communities, and it's also as if not all of these people in these communities are economically facing extreme hardships. They're not. So there are dollars. So it's not just about dollars and cents. There are means in which we can afford and do cheaper things that are better. So again, how do you fix that? It's the messaging, it's understanding, it's realizing that in the Black and brown community, it's even more disproportionately so the heart disease and the deaths and things of that nature, where it needs to be fixed.
Dollars and cents. I will always that, because until it's proven wrong, and I haven't seen it proved wrong yet. To your point, you're saying the food deserts, etc. Again, that's also a dollars and cents aspect.
But that's not from the masses. That's from the corporate standpoint. From the
dollars.
Right.
Where can I make money?
That's not from the demand.
All I'm trying to say is
that's from a supply standpoint.
Correct, but also the demand can drive the supply. Right. For example, where I live right now, right, in the area I live in Miami. I was talking to there's an open plot of land, and there was a thought process of putting in a Walmart there, and it was shut down, right? Yeah, and the reason it was shut down was because of the demo. They didn't want the Walmart, quote unquote, the Walmart demo here. On the flip side, they're opening a Trader Joe's because that suits the demo, right? My point is the demand can change why, right? So, but also what happens all the time is you have to have, it's come back to own sense. If I am in if I'm in a community where I'm watching my pennies, right? And there is a low cost option for sustenance, not health, satiation, for me to be full, I'm going to go with low cost option for me to be full, plain and simple. That's not, because that's just the way it is, right? And so and if you brought me an apple, I'd be like, F you, because I'm hungry, and the apple doing ish for my hunger. The apple is great as a supplement, but that's an additional cost. So once it comes with what I'm already consuming, right? If I'm getting a burger for $1, right, and the apple is going to cost me whatever, I'm throwing numbers out there, right, 30 cents, for example. That's a lot, man.
Right, but you keep assuming that the only people supporting these low-cost options are the economically challenged, where that's factually incorrect.
You just said that there were all these things associated and surrounding that community in general. That was your hypothesis.
No. What I'm saying is people in general in this country are doing that. Now, you're also assuming that the darker communities are poor communities.
No. I'm saying those communities specifically. You're talking about the communities that have these food deserts are generally
the food deserts. Yeah, but I'm talking communities.
Right, I'm giving you back when you're talking about your areas. I'm not talking about the globe. You gave me a specific area in a demo, and I'm speaking to that specific area in demo, and now you're making it a broader subject matter. This ain't Boca. This ain't whatever. We're talking about areas that are predominantly lower income, and what is applied to them. To your point, how do we change that demo? And I'm not even referring to color, because if you're in rural America where it's predominantly white, also low income in that scenario too, the same thing applies. Yeah. They're going to have the local chicken shack and the local whatever it is, that's not generally the healthy way to eat, but is cost effective. Go ahead. Sorry, speak.
Not always cost effective. And we're going to do next time in Miami, we're going to do an hour drive around different neighborhoods. And we're going to document it for the show.
I welcome that challenge, and I guarantee you, right, that if we go with what you want to eat versus what's cheap and cost effective, one, I will be more full eating the cost effective meal than you will be eating the more lavish healthy meal. And if we play that game, I'm going to win by way of satiation using that as the gauge.
We shall see.
All right. On that note, we'll wrap up today. We'll chat with you guys when we're on the road. And by the way, he says the road thing. I haven't seen this dude in like 3 months, and we're doing these things remote. Apparently, he's just getting lazy over here. This dude used to drive his ass down there. We should do it. The sound was better. We had a whole situation. We bought equipment. Now we using none of that. This guy can't even buy headphones now. We spent all this money on stuff and nothing. And now you guys getting a poor quality because this guy's getting lazy over here. Just so you know, this gentleman. I even volunteered to come up to Boca, by the way, and no, but now I need to get to rip the floors out, redo my house, do all these things, change things like that. This guy's,
fake news,
swimming around naked. I can't even go up there anymore. It's scary now.
Yeah, I think I'm gonna do that right now. No joke. Get a little sun. The problem is my lawn guys may show up. That could be bad. No, not good.
this guy's a lawn guy, all right? We're living two dimensions, and he's worried about the cost of people doing whatever. Yes, case in point. You are your own worst enemy, man.
You're coming in. Your mic sucks. You're coming in blurry. No joke.
All right. Well, I know we will.
Justice over order. Eat better. Be better.
Take it easy, y'all.
Cool.